Hi, I'm Jon McHenry, one of the principals here at North Star Opinion Research, and wanted to speak for a few minutes about healthcare, what we saw used in the 2010 election, and how we anticipate this panning out as an issue for both Democrats and Republicans in the 2012 election.
It's important to remember that the healthcare debate this year takes place in the context of the healthcare reform bill that Democrats passed in 2010. If we look at this pollster.com chart, we can see that opposition in 2010, just after passage, was 43% support, 47% oppose, and stayed relatively constant throughout the year, and has now grown to a 50% oppose, 37% support margin that we see at the end of the chart. The reason opposition to the bill has grown is that even from before it was passed, voters thought that the Obamacare plan would increase their taxes, increase the federal deficit, increase healthcare costs, and increase insurance premiums, while a plurality thought that it would decrease the quality of healthcare that they were receiving. In our work for Resurgent Republic, we've tested the liberal argument for healthcare reform that was passed last year and the conservative argument against Obamacare. Congressman A, the liberal argument, says healthcare reform has been good for America. It has provided health insurance to those who didn't have it, is controlling healthcare costs, and holding the insurance companies accountable. Congressman B, the conservative point, says Obamacare has been bad for America. It is raising healthcare costs, cut $500 billion from Medicare, and injected government bureaucrats into healthcare decisions. Conservatives win that with plurality support 49% to 44% preferring the liberal argument. But you can see among independents a majority joining the majority of Republicans who prefer the conservative argument. It's important for Republicans to understand that entitlement reform should not be justified in budgetary or fiscal terms. When we've tested sort of the classic Democratic argument that we should not balance the budget on the backs of our senior and the poor, we need to cut back federal spending, but Social Security, Medicare, and Medicaid should be off limits, that argument wins by a sizable margin over the Republican argument that says we will never get the deficit under control without making at least some adjustments in Social Security, Medicare, and Medicaid, because those three programs make up more than half of all federal domestic spending. That margin is fueled in part by just a narrow victory among Republicans and independents agreeing with Democrats. Republicans have far more success when they're arguing in terms of saving programs for future generations. Here we've tested Social Security is in real trouble because of so many retiring baby boomers. We can save Social Security with minor benefit adjustments for people age 55 and under, and we should do that now rather than wait until the program faces a crisis. In that framing, Republicans win by a 53 to 40% margin overall, including a 61 to 34% margin among independents.
As we saw in 2011, when Democrats used the healthcare issue to attack Republicans, if there's no response, as was the case in New York 26, the Democrats won fairly easily, as we saw in Nevada 2, with a quick response that talked about what Democrats actually did in the healthcare reform bill, cutting $500 billion from Medicare, a well-received Republican response, and a Republican that went on to a substantial victory.